So endometriosis is a condition where there are cells that are typically on the inside of the uterus, similar to the lining of the uterus, that are growing on the outside of the uterus. So it could be growing on the surface of the uterus, it could be growing on the tubes, on the ovaries, or anywhere else in the abdomen. So it could be on the bowel. And that tissue causes inflammation, it causes scar tissue, it causes significant pain to people. It can also lead to infertility. Yeah, so the common symptoms with endometriosis are pain with periods, pain that's getting worse as the years go on. It could be pain that starts to progress from not just during the period, but every day during the whole month. Sometimes the pain is with intercourse, so there could be painful intercourse, painful bladder symptoms, painful bowel symptoms, and sometimes the symptoms are that there is no pain, but patients are experiencing infertility, and that's how we discover their endometriosis.
Endometriosis can affect anyone who has menstruation. So from the early age of menarche, when you first get your period as a young teenager, all the way up until menopause, it can be an issue for people because they don't know if this is normal. Oftentimes women are told that pain is normal. It's something that is accepted, and a lot of people don't know that they're actually suffering from something that can be treated until much later. So I think it can affect anybody, and it really should be on your radar if you're finding that it's something out of keeping of what you think is normal, to kind of bring it up, advocate for yourself, and ask a provider to investigate to see if this is more than just regular period pain. Endometriosis is not only limited to gynecology. It is a gynecologic disease, but it can present in other ways. So bowel-related symptoms in terms of bowel pain, pain with defecation, constipation. It can also present as abdominal pain, bladder discomfort, urinary tract issues, and even uncommonly, sometimes you can get endometriosis affecting your lungs or your diaphragm. So chest pain, shortness of breath, coughing. So really it is something that's widespread. It can spread to other parts of the body. So it is gynecologic in origin, but it can present in other ways. And so that's very important for our specialists to also recognize that maybe our other colleagues need to be involved or have it on their radar. So urologists, our lung specialists, our general surgeons, for example.
Good question. There's good treatments. Surgery can be curative in some people. We often recommend that even if there is a good surgery, that we try to prevent endometriosis from growing back with certain medications, to prevent endometriosis from growing again, which can happen. But we can't necessarily always provide medical treatment for everybody because not everybody tolerates the medications. Some people tolerate them very well, some people are very sensitive to medications. So we try to treat people as best as we can with endometriosis. We're hoping that eventually there will be a cure for endometriosis, that we can say for sure there is a cure for it. We know that we can treat it fairly well in a lot of people, but it is kind of a lifelong condition that we do have to manage. So surgery is one option for endometriosis, but we do try to provide medical treatment of endometriosis, so to suppress the endometriosis, meaning preventing it from growing, preventing it from causing that inflammation, that pain that it causes. There's a variety of different medications that we use. Sometimes it's a birth control pill, sometimes it's a progesterone-only type of pill. There are injection versions that we use of medications as well. So there's a variety of different medications that we use that we try to use instead of surgery or in combination with surgery. But it depends again what the issue is and how people tolerate their medications, if we're able to continue on medications or if we do have to progress into surgery.
At Humber, we're very fortunate to have an excellent team of surgeons and very collaborative colleagues. As we alluded to, that it is gynecologic in origin, and there's a few specialists in our department that do specialize in endometriosis surgery. We're very well attuned to treating it medically and understand that this is a very common problem that often goes unrecognized, and a lot of patients suffer without having their disease recognized and understood. The other thing is that we do have medical imaging available at Humber to help us identify these lesions and how to treat it. Collaborative urologists and general surgeons, when they do need to get involved if it is affecting their part of the body. One of the most common myths I think that I've heard a lot is that if we take out your uterus, it will cure your endometriosis. But in fact, even though it does originate from the lining, it's actually hormonally driven. So unless your ovaries are suppressed or they're actually surgically removed, The endo can always be growing, even if it's microscopic and we don't see it, because it's hormonally driven. So until menopause, or we're able to suppress your hormones with medication, then it's something that will persist even if your uterus is removed. And that's one of the most common questions we get. It sometimes leads to people having hysterectomies, but we now know that that's not a real indication to treat the endometriosis. We have a great network across Canada. Obviously, internationally we do as well, but specifically for endometriosis, we do have a network available for you to find a provider. Some of the websites that people can reach to, if you're looking for an online resource, is endometriosisnetwork.ca. So across Canada, you can look for providers in your region that can treat endometriosis, or you can be referred to. There are also online support groups, so you can speak to other people who experience the disease and get help from other people suffering from this, as well as Endo Act is another one. And we do have some representatives who are going to speak about that.
Hi, my name is Tammy, and I'm one of the co-founders of Endometriosis Events. We are a registered charity that raises awareness for endometriosis by facilitating workshops and hosting events and hosting support groups the first Thursday of the month.
And hi, my name is Yeung, and I'm also a co-founder of Endometriosis Events. We are raising awareness this Endometriosis Awareness Month here at Humber River Hospital, and we're honored to be here to share some information about endometriosis and what services we offer and how we can help endo warriors and supporters with this disease. The month of March is Endometriosis Awareness Month, and we have held several events for the community to raise awareness and to lend our support, including a kickoff Friendo Social, where we hosted a film screening for the film Below the Belt, which was amazing and well attended, and we have further events coming up this month as well.
This month, for Endometriosis Awareness Month, we had the CN Tower in Niagara Falls illuminated yellow to raise awareness. It was great to see yellow all over the city. To find more information on endometriosis events, please visit Instagram and Twitter at Endo Events.
We're also found on Facebook, and our website is endometriosisevents.com. Our email is endometriosisevents@gmail.com. Thank you for connecting with us.
Thank you.